And we are live. Welcome everybody to Lubbock Compact Live for Wednesday, July 13th. We are on our third week in a row of doing shows. We're doing pretty good. Got a good run going on here. Um, of course, I am your host, Adam Hernandez, with my co-host, Dr. Nick Bergfeld. And we also have a special guest, Angela Martinez, who is the Health Center Manager for Planned Parenthood. And she will be discussing some things about their funding and then what services they provide for the community. So, going to be some good information here on that. And our only update for the city for this week is the committee that is looking at redoing the street bond election is still ongoing. We talked about this last week. Of course, I am on that committee, and so just want to keep everybody up to date with what's going on. We had a really good meeting. These meetings are happening every Friday at 10 a.m., so we have our next one coming up in a couple of days at 10 a.m. on Friday. There is a Zoom available, and I will get that posted out earlier than I have been. I've been a little late posting that, but we'll get that posted out so that if you are not able to make it down there, you can check it out on Zoom. And just a reminder that you can email your comments for that to achavez@mylubbock.us, or you can come to Citizens Tower to the second floor conference room where we have the meetings and give a public comment there, or you can also give a public comment on Zoom. So just a reminder for that. And where we're at with that, last meeting was pretty productive. I think we took about maybe 3.5 hours total that day, discussing a whole lot of things and looking at some streets all across the city and some different areas. And so really encouraging to see this thing moving along. City staff has been great. They've gotten us all the information. We need more information than we even asked for. And so it's been really good. And so we've got a tentative list that we're going to be discussing as far as like what roads we're going to be looking at, what the cost is going to be. We're going to try to hash this all out. We've only got a couple more meetings unless we have to throw an extra one in there before we present our recommendations to City Council on the 26th, which is the plan. So one encouraging thing that's different from the last bond election. So in the last bond election, the City Council members who were kind of directing that kind of had a rule that they only wanted to look at arterial streets. So like big streets like 50th, 34th, things like that. The issue with that is that we obviously want to do streets in every district, right? And in a couple of districts in particular, District 1 and 2, in the older areas of those districts, there's no arterial roads that need to be done. A lot of those are TxDOT roads, which means the state takes care of those. And some of those roads have already been done or are being done. And so there's just not a lot of needs on those main roads in those areas. So we brought up that maybe we should look at neighborhood streets. And so that is an option. That's what we're looking at in particular in those older areas of District 1 and 2. So that's really encouraging. I can't report any specific areas yet because we've got to discuss that and see what we're exactly going to do there. Of course, final reminder on this, the city just does not have the money to do all of the roads that we need to do across the city. So however it works out, there are still going to be many roads in the city that are still going to need to be done that we're just not going to be able to touch this time. But at least we'll be able to move things along a little further and maybe get some of these roads taken care of in these older areas of town, like in East Lubbock, where I grew up, that have been that same way all of my 41 years of life. And so that's really encouraging to me. Also, same thing in District 1. Those streets have been in the same condition for many, many years. And so really encouraging what's going on. There is a particular road that I know that many of you may be concerned with, which is Alcove in between, 98th Street in between Alcove and Upland. There is a friendship school on one side of that road. On the other side of that road, there's a whole bunch of new residential developments. The traffic is crazy there, obviously, because you have all of that going on. And that stretch of road is dirt, ladies and gentlemen. It's dirt road over there with all of that activity. It's really dangerous when it starts raining and all kinds of stuff. The school buses have issues. Just it's a mess over there. So that is something that the entire committee is fully behind. And so those folks that have been dealing with that over there will be happy to know that that will definitely be in consideration for the street bond. And that's something that we're all very strongly for. So just some good news. Of course, there's some other stretches of roads you may be worried about. Again, never hesitate to reach out to me or anybody else that's on the committee, or email achavez@mylubbock.us with your comments and suggestions and ideas. So that's the update on the Citizen Advisory Committee looking at the street bond. And so now we can go ahead and get into our conversation with Miss Angela Martinez. And of course, Planned Parenthood is a healthcare provider here in Lubbock. They provide lots of different services for the community. Obviously, they've been in the news for some other things, but today we're talking about the healthcare options they have for the community and some of their funding and some really exciting things. So Angela, welcome and thanks for being here.
Thank you so much for having me. It's good to be here.
Yeah, so I guess what we could get into first, I guess, is maybe the funding piece of this, because then that kind of controls everything, right? So we're talking today about Title X funding, right?
Mm-hmm.
Awesome. So can you tell everybody, kind of give them a little rundown of what that means? What is Title X funding? What does that allow you all to do?
Yeah, absolutely. So we Planned Parenthood Greater Texas is our affiliate, and they applied for a grant for Title X. It was a dire needs grant, which means they provided funding for areas without any Title X health centers. So a part of Planned Parenthood Greater Texas, Lubbock and El Paso were both approved for this funding. And it's a 2-year program. I believe it's 2 years. I think so. And it's Lubbock County has not had, or Lubbock City has not had, a Title X health center, I think, in 4 or 5 years, I believe. And so we got this new grant. We're able to see a variety of different people coming in, uninsured, underinsured, people who might have insurance, but for some reason may not want their parents or their partner to know that they're coming for Planned Parenthood for certain reasons. So we're able to see these people on a sliding scale. So depending on family size, income will depend on if people have to pay. I'm sorry, there's a fly. If people have to pay and how much they have to pay. So it could be nothing, it could be, maybe $100, but it's definitely something we try to discuss beforehand so that it's not a surprise whenever people come in.
Yeah, and I think one important thing to know, I mean, that's great that folks who may not have insurance or may not have means to pay for healthcare can get that taken care of. But I think it's a good thing to note that Planned Parenthood is not just for women, right? There's men can take advantage of these services as well, right?
Absolutely. And that's what's great about Title X is we know that there's Healthy Texas Women, which is the women's Medicaid, but there's not really any funding for men. And we're actually not able to accept Medicaid. So people who normally have Medicaid, or especially men who might need our services, are able to also be screened for this funding, which is really important.
Awesome. And so that's a good thing to know. And also, just real quick before we go on, quick reminder for everybody, if you have questions or comments about today's discussion, please put those in the comments and we'll see those. So I guess we can get into some of the services. So what are some of the services that women and men can take advantage of with Planned Parenthood?
Yeah, so the health center that's in Lubbock is a family planning clinic. So we offer different types of birth control options. So we offer the pill, IUDs, which are intrauterine devices, the implant, the depot shot. So maybe you might maybe someone might have trouble remembering to take a pill every day. We do have those forms of contraception that last a little bit longer between visits. We also offer cervical cancer screenings, breast exams, pap smears, emergency contraception, pregnancy tests, along with all options counseling, also STI and STD testing. And we also offer treatment as well as partner treatment. So just in case, their partner can't come in to get tested, we offer that treatment as well. Oh, also PEP and PrEP, which I think is really important, and any UTI or you know, vaginal bacteria or infection checks.
Got you. Got you. Well, lots of good
A long
services.
list.
Yeah, long list of services. Nick, do you have any you want to chime in here?
Yeah, I want to talk a little bit just on the numbers when it comes to services. How, when you look at some of the health statistics of Lubbock, we have elevated rates of sexually transmitted infections. Historically, we have elevated rates of unanticipated teenage pregnancies, higher than state rates in intimate partner violence, child abuse. When you see the needs that are here in the Lubbock community, where do you see the role of Planned Parenthood and the Title X services? Where do they fit within that world?
Absolutely. I think that's a really a great and important question, especially for people in Lubbock, and not even just in Lubbock, the surrounding areas as well, the rural areas also. But I know that there are other clinics and health centers in Lubbock, and so I don't want to ever discount the work that they do, but there can always be more, right? I think we all saw that statistic of syphilis jumping 300% in the last year, and I really do think that part of it is Planned Parenthood being in Lubbock the last couple of years and needing to report those rates and seeing people and getting them treated. And so I think there's a huge role in filling this gap of the uninsured and underinsured, and that's why Title X is also great. Is we are able to see people who are under 18 without parental consent. I think that that's really important, that they're able to come in to take ownership of their bodies and making sure that they're getting seen and getting on birth control or getting tested and getting treated. Thank you.
And then one other piece I wanted to come back to on services, just to touch on, and it might be a larger discussion as well. You had mentioned that y'all provide PrEP and PEP services.
Mm-hmm.
And in Lubbock, I having friends and growing up here in the LGBTQ community, I know that historically it's actually been quite hard to afford PrEP in Lubbock for a long time. That was very costly. And then another piece of that is just simply to access it. Could you talk a little bit about PrEP and what y'all can provide to people with that?
Yeah. So what I think is great is we are able to offer same day and next day appointments, which is really important when you're trying to access PEP, which is the
Post-exposure.
after. Yes, thank you. So I think that that's really important. And then with that post-exposure, and then with PrEP, which is the preventative medication, I was going somewhere and then I lost it. I'm sorry. But that does qualify for Title X. So people can be screened for that. So visits can get quite spendy. There's a lot of lab work. So I think that you're applying for that Title X funding will be helpful in preventing any HIV transmission. There's also additional funding called Gilder-Lehrman, which assists people uninsured and underinsured in receiving PrEP. And we do assist in applying for that and making sure people are able to get accepted for that program.
That's excellent. And what do you happen to know what the cost for a low-income patient would be to get PrEP through y'all?
I don't know how much it is because we have to send it to a pharmacy. So I'm not 100% sure. I'm sorry.
No, fair. I think it's wonderful just simply that service is available through y'all. Talking about HIV and the HIV population here in Lubbock is a very difficult topic. They're very much so swept under the rug, and these issues are very rarely discussed. And the fact that there is such a powerful tool now when it comes to medications that can essentially reduce the probability of transmission to near zero when done effectively, it just, to me, it's just how do we get access to this, right? How do we promote it? How do we get sort of broader coverage? And I love that this is something that's in the Planned Parenthood portfolio of services, is actually these kind of components as well.
Absolutely. I love that we're able to offer it. And I really, I think that visit has picked up which means that conversations are happening between communities, and I think that that's really good.
Yeah, I also think, I spend some time working with young students at OL Slayton. And so I get to see and hear about a bit of what's going on out there. I have my own experiences, obviously, growing up in the situation that I grew up in. And I know how difficult it can be as a teenager to be going through certain things and not being able to, or maybe not having mom and dad or a guardian around that you can talk to about these things or get to the doctor. I mean, what is the impact you've seen for those services for young folks in those positions? I mean, it's got to be pretty big impact for their life, I would assume.
Yeah, I think so. I do think for a majority of my people under 18, they are coming in with their parents or their guardians, a family member that they trust. I think that that's really important, and we always encourage parental support whenever we see people who are under 18. But seeing people really come in and making sure that they're being seen and making sure that their partners are also being safe is really nice. And knowing that the future is concerned about themselves and their health. But there is a part of, or that small section of people who just aren't getting maybe the sex education that would be good. And I was raised in Lubbock ISD, and so I know the type of education that they're getting. And I'm glad that Planned Parenthood is a trusted space, and a safe space for people who are minors to talk with our clinician and really ask questions, and hopefully be seen and acknowledged maybe whenever they can't anywhere else. But we are also mandated reporters, and so if we do see or hear something, then we do have to report that to CPS, as well as everyone is screened for intimate partner violence. I know that y'all mentioned that earlier, and I definitely wanted to touch on that as well.
Yeah, and so as far as outreach goes, Nick touched on this a second ago. As far as getting this out to more people, how is that going for you all, and how are y'all approaching outreach? Like, how do y'all get this information out to the greater community?
Well, events like this is really great. Being a part of different organizations that also touch the community. Not just in Lubbock, but like I said, everywhere else. This is really helpful. I know with recent news and rulings, we've received a lot of questions about whether we are still open or will continue to be open. And I think that's really number one, is making sure people know that we are around to provide these other amazing services of testing and treatment, birth control and PEP and PrEP. We don't have an outreach person yet, but I hope that we will be finding someone soon. And so I think that hopefully they'll be able to organize and really rally a bunch of volunteers. And I know that people are really energized, and we have a really good support within the community. And I know that we're also doing a lot of tabling with Lubbock Pride, which I think is great. And then a lot of different pop-ups that are happening around town and downtown. I think when you see the pink shirts, you know that we're around.
Yeah. So to touch on something you just spoke about, I'm sure you're getting a lot of questions about the future of Planned Parenthood here in Lubbock. As you said, with all this stuff in the news. I guess internally within Planned Parenthood and the greater organization, are there any concerns that I mean, obviously we know certain services can't be done, but as far as the services you just talked about, is there any concern that any of those services may go away in the near future, or in the future at all? Or do you guys anticipate that you're pretty secure out here and that you'll be able to be around for a long time? Like what is the read on that?
I think immediately after the ruling came out or any big news has come out, there's always a little bit of concern. But I think the Title 10 grant is really helpful in pushing our services, and getting to see as many people as we possibly can. So I think the demand is here, and I know we'll be around for as long as we are needed, hopefully.
Awesome.
Angela, I just wanted to ask, about, the journey to working in this kind of space in the healthcare industry is usually a pretty unique one. What was it that motivated you to want to do this kind of work?
So let's see, I actually worked for Planned Parenthood before they closed in 2013. I graduated from tech with my undergrad and then started working there for about 3 years before it closed. And then I went to grad school, and after grad school is when I heard rumblings that Planned Parenthood was opening back up. And I wasn't going to apply. I'd gotten my master's. I had a really good job. But I kept hearing that they were still needing a manager. And so I applied and I got it. And I think with the way funding works and with what happened last time in 2013, there were a lot of people who were concerned about me jumping back in. But I mean, I loved it the first time, and I feel like it's only gotten better. I think our mission is broader, and we're seeing more people. We're seeing a wider range of people for different services, and conversations are getting better and deeper, and we're talking about things that I didn't think we ever would have talked about 10 years ago. And so I think being a part of an organization that's really open like that is really good.
Oh. And I also love that you have that context of what we wouldn't be talking about or are talking about now because of how times have changed. And I also think it's very unique that you also grew up in Lubbock, just like me and Adam did. And yeah, I'm just curious, how does that, how do you feel like growing up here has impacted the way that you view the work?
Gosh, I have no idea. I don't know how to even answer that, because I think I've had just a really good bubble. I think, I've had, really supportive parents, and I mean, I think I was definitely more radical than my dad would prefer me to have been. But I mean, I've moved him over a little bit more, but I've always had really supportive parents and really good friends who have always, we've supported each other and know, kind of how each other's jobs work. So yeah, I think that's good. I don't know.
Yeah, well, awesome. So I guess how could or what's the best way for folks to reach out? Could they just walk in? Do they need to make an appointment? How does the process work for somebody who may be needing some services from Planned Parenthood?
Yeah, we always try to take walk-ins, depending on how busy. We definitely always try to take walk-ins. Making an appointment is preferable. You can go to ppgreatertx.org to make an appointment. You can also call our phone number. That's 806-696-3436. Y'all can call and make an appointment, and we see a wide range of people, so we'll try to hurry up and get in. We also take insurance and do cash pay also, so it's not just Title 10 funding. So if anyone else if you have insurance and would like to use it, we would take it.
Oh, okay. Oh, nice. That's good to know. Yeah. Yeah. Awesome. Well, Nick, do you have any other questions? Anything else you want to throw in here?
I guess my questions I'm really just sort of fascinated by the patients, by the people that you get to work with, and folks who are coming in and requesting your services. And I'm just curious, through how impactful is the Title 10 funding on this? So how frequently does someone come to your facility and they can't afford what it is that y'all would want them to be able to have access to?
Yeah, it's a pretty large number, and I think and the reasons why are so many. I don't want my parents to know I want to get on birth control. I was just released from jail and I don't have a job, or I don't make enough money, or my spouse is the only one that works and I don't, and we have kids. So the reasons that everyone gets screened for it's you don't have to provide proof of income, everything's done verbally, and so if you qualify for our funding, you're able to get a lot done.
Awesome. Awesome. Well, great conversation here today. I don't have any other questions. I think a lot of great information was shared here. I would ask that everybody share this with your family and friends. Let them know about this. Let them know that there is the sliding scale with the Title 10 funding, but as Angela just pointed out, you can also use your regular insurance. Everybody that I've met from Planned Parenthood has been great. I've never had to use the services, but I know many people from the board and different people that have worked with Planned Parenthood over time, and just a great group of folks. And so I think it's a really great service that you all provide. I would ask that folks not look so heavy at what's in the headlines. And don't let that color your perception of Planned Parenthood. As you've heard here today, there's many different services that they offer, all very necessary, especially as Nick said, in our area where we have such a high rate of STDs, unfortunately. I think that services like this become more necessary, but it also becomes more necessary to get the outreach out there. And so I hope y'all do get that outreach person very soon. That would be good. But in the meantime, we will always welcome you on Lubbock Compact Live, and anybody else from Planned Parenthood who would like to talk about whatever you all have going on, or discuss anything at all. So just want to say thanks again, Angela, for being with us. And as we wrap up here, I do want to remind everybody, besides our Citizen Advisory Committee meetings at 10 a.m. in the morning on Friday morning, we also have Dr. Nick at 10 a.m. On KTTZ.
9 a.m. 9 a.m. on 9 a.m.
9 a.m. Excuse me.
You can do both. You can do both. You can catch both.
Yeah, you can catch both. So yeah, watch Dr. Nick or listen to Dr. Nick at 9 a.m. and then check out the Zoom meeting for the Citizen Advisory Committee at 10 a.m. But also did want to give a quick shout out. We are having a community job fair that Lubbock Compact is hosting. That's going to be happening on July 26th. Planned Parenthood is very welcome to come out and participate in our job fair if you guys want to continue your search out there. And it's going to be Tuesday, July 26th from 6 to 8 p.m. at the YWCA on University. And so we have the event pages up on the Lubbock Compact page. We'll be sharing that as well, so you can check that out there. And so just want to let everybody know about that. We're going to start beating the drum pretty heavy on that. And we have some great organizations already have signed up, just a few. We have a couple of the City of Lubbock departments. We have LPD will be there, Lubbock Fire Rescue. We've got Express Pros. Hopefully Planned Parenthood. we've got lots of great organizations out there that are all looking for people. and going to be some great opportunities for some careers. Hoping to have Covenant out there again. We had Covenant and UMC at the last one, hoping to have them again, but we're growing the list of organizations that will be out there. So again, that's happening on July 26th. That's a Tuesday from 6 p.m. to 8 p.m. at the YWCA on University. And so, yeah, just once again, thanks to Angela and Planned Parenthood for all you guys do and for pursuing that funding and getting that funding so that you can expand your services. Just thank you all so much.
Thank you. Thank you for having me. Y'all are so delightful. It's good talking to y'all.
Thank you.
Yeah, thank you. So check out, and the website once again is
ppgreatertx.org.
Okay, ppgreatertx.org. You can make your appointments there, or you can kind of learn more about their organization. And I'm sure the number and all that is on there. You can call their office, or you can go down there and visit. And so please check them out. Please pass the information along. And this is your weekly reminder to join your neighborhood association. And we will see you back here next time. Good night, everybody.